After tearing it, remove it carefully. You can remove it carefully. So for this case, you see we have the inner part and the outer part. So while putting on the condom, try hold the tip. We have the tip with us here. So while wearing it, hold the tip. This to avoid trapping air. The air which during the intercourse, it may burst. So this is why we have many cases of condom ilibasuka, many complaints. So you should hold the tip while putting on. Then you can put it at the tip of the penis, then roll it down.
Hi guys, welcome to the group podcast. Karibuni sana. Thank you so much for checking out this video. I go by the name of Nancy Korea, and today I'm talking about everything contraceptives. I have an amazing guest in studio with us today, but before we even get to that, you guys can always interact with us on our social media platforms. You find us at the group podcast KE on Instagram and YouTube and Facebook and TikTok. You can also DM me at Nancy Korea on Facebook and Instagram. And kama kawaida, we're recording at Migwi Studios. Make sure you check them out on Instagram, or you can call them on the number on the screen. And najua mnauliza Simba kwa wapi leo. You guys nimemtuma kaende school fees because today it's all about ladies. So guys, make sure you don't go anywhere. Stay tuned because I have an amazing show lined up for you. So like I said, I have a very beautiful, amazing guest with us on studio, and I would love for her to introduce herself. This is her first time, but well, it doesn't seem like it's her first time. So we breathe in, we breathe out. Yeah, we're going to be having fun. So introduce yourself.
Oh, thank you so much. I'm Frida Sato. I am a nursing practitioner. I've been practicing for the last 3 years, and I'm so much humble. It's a great opportunity to be at the group podcast. Thank you so much. And today it's all about contraceptives, and I believe you're going to learn. I hope you'll enjoy the session. Thank you.
Yeah, so you can hear thank you. Thank you. Anyway, you guys, as you can see, we have even samples around here, so it's going to get hot and real. So if you have a sister, if you have a mother, if you're a wife or your girlfriend, tell them to make sure like they check out this video because you're going to be learning a lot today. So Frida, thank you so much for coming again.
Yeah, well,
thank you. Yeah, it's really nice to have you. So before we even get to this, let's talk contraceptives and family planning. Ni kitu moja ama ni different, and what are even the functions of contraceptives?
Oh, so contraceptives and family planning, they are linked together, but I can say contraceptives are part of family planning. When I talk of family planning, it's broad. So family planning involves of contraceptives. This where we have the antenatal clinics, where we take care of the pregnant mothers. In family planning, this where we have the immunizations. In family planning, this where we have the contraceptive. So contraceptives aside, these are drugs, devices, or you can use the surgical procedures to control birth. Yeah.
Okay, I'm so glad I didn't do medicine because I'm like, I thought you one and the same thing.
I know.
I thought it's one and the same thing.
No, they are linked together. I can say family planning is part of contraceptives is part of family planning.
Yeah, I think I would be a good doctor. At least you're the line.
You can be.
Anyway, so like unajua kuna kwanga na these quack doctors and real doctors, and sometimes it's really hard to know which, where to go to get these contraceptives. So as a doctor, as a nurse who have been practicing for the last 3 years, where would you advise for one to go and get these contraceptives?
To do with contraceptives, I will advise one. You can visit the health centers, like health facilities. On the public sectors, we have these contraceptives. In fact, you can get them at a fair price or on free. There are these days that they are offered on free prices, so you can get them there. Or on private sectors, I think try find a clinic which is approved.
Okay. Make sure like you
Yeah,
go
come
and
on.
survey fast enough.
Survey fast,
before you
get to
there.
know about the clinic, how long it has been functioning.
Yeah.
So
So before you go,
Yeah.
because where unaweza shtuka hii
Yeah.
Kenya.
And
yeah?
I can advise for the youths. You can get contraceptives on. There are these health facilities that have set aside youth-friendly like facilities.
Okay.
So for those youths who will fear like to go where they're joined with the mamas. So
Dispensary unapata mko yako.
so you can take advantage of those facilities.
Okay.
There you'll get well-trained personnel and you can get the contraceptives.
Okay. So
Yeah.
I'll also ask, like, what is the appropriate age to be on contraceptives? Especially for youths na madem, unajua? Yeah. Because most of us, we are like, ni za mama zetu. Us, we are like, we are way too young for that. So, which made me think, what is the right age to be on contraceptives?
Not really. I think at 16, there's no problem with that. So because at 16, one has achieved menses.
Yeah.
So one can receive the contraceptives. But this, with the precaution, like you'll have to see a doctor who will talk to you about the contraceptive, choose the best method for you,
Yeah.
so that you'll not have any other effects of it.
Okay.
So contraceptives can only be given also to those who are sexually active.
Yeah. I
They're-
wanted to come to that. I wanted
Yeah.
to come to that. Yeah.
Because there are those who even achieve their menses even at 14 years.
Yeah.
So for this case, you won't deny this young lady who is at risk of unintended pregnancy, who will later on try to do abortion. So for this case, you are going to give this lady contraceptives.
So as long as ashajua hii mambo, like we're talking about, they need to be like put on contraceptives.
As long as ashajua na
Yeah.
haezi avoid, there's a need to.
Yeah, and it doesn't matter whether they're 14, because I usually feel like even our mothers don't talk to us about contraceptives and all that. That is where we end up like getting pregnant, getting married, and there's nothing we can do, because we also didn't know how to like prevent that from happening. And that is why today, guys, we are talking about everything contraceptives. So yeah, be keen. So now let's get to this. Types of contraceptives. I can see like umekuja na kadhaa hapa. So talk to us about these types.
So with me here, I have some samples. And contraceptives, I think I will classify them into different groups. So I'm going to talk about the hormonal contraceptives. I'm going to talk of the non-hormonal contraceptives, which I can say they are the barrier methods, but they are type of contraceptives. I'm going to talk of the permanent contraceptives.
Okay.
So
permanent.
yeah.
Okay, so let's get into all this.
So for this case, under the barrier ones, which are also they are non-hormonal. This is where we have the CDs, the condoms. We have both the male condom and the female condom. So for this case, I have the male condom with me.
Yeah, do you guys, and is this a rate inapeanangwa na government?
Yeah, in fact, they are free. They are free. Don't miss a condom because you lack 50 bob.
So you guys, there's no way you are making excuses when these things are free. Like, but kuna times because zimeisha Kenya, but I think right now.
But they're not expensive. You can get them at 50 bob.
Moja.
Yeah.
Yeah, so I have a condom with me, so where do I go from here? Like, I have a condom, so what's next?
So at any point you purchase or you take one from the government hospital, kindly check the expiry date, confirm
2025 inbox,
for this, which means it's not expired. So for this case, opening it, kindly be careful. Ensure you do not interfere with the condom. So while tearing, tear it carefully.
Okay. Yay.
Yeah.
Oh, I want to say it's. Let me not use that word. It's oily. Anyway, yeah.
This. After tearing it, remove it carefully. You can remove it carefully. So for this case, you see we have the inner part and the outer part.
Okay.
So while putting on the condom, try hold the tip. We have the tip with us here. So while wearing it, hold the tip. This to avoid trapping air. the air which during the intercourse it may burst. So this is why we have many cases of ati condom ilibust, ilipasuka, many complaints. So you should hold the tip while putting on. Then you can put it at the tip of the penis, then roll it down.
Oh.
Yeah.
Okay, so see, ladies, you can also do this. I feel like it's very simple. You can do this.
Yeah, ladies can also help in doing this.
My mother is not going to watch this video because
Ashanga experience
and
talk.
Thank you so much for that. So, what do you do in case a condom, burst? How then do you make sure that you don't get up being pregnant?
So in cases where the condom has burst, so already it's a mess. So for this case, you can withdraw. Then thereafter, go and buy the postnatal, the currently known as the P2.
Okay.
Yeah, that can help you.
So let's get into P2. So you guys must burst, you go for P2.
Yeah, go for P2.
So would you say P2 is a contraceptive whatever method?
Yeah, P2 is a contraceptive. Yeah, because it's a birth control method.
Yeah.
Because we can use that example. After bursting, see you trying to avoid pregnancy. So when you go for P2, that will prevent you from conceiving.
Okay. So kuna hawa watu wanasemanga alikunywa P2 na bado they got pregnant. Ama how long do you like take P2 after, after sex? And how soon do you even take that P2 after sex? Like, do you take it like immediately after that? Ama in the morning? Ama, what is like the right way to take P2?
P2, when you buy P2, there are two.
Okay.
There are two pills. So for this case, P2, it contains progestin. So that's why when you use P2, its duration, like it can only protect you when for a period of 72 hours. If you take it before 72 hours, so it will be more effective when you take it even immediately. It will be the better. But kindly take it before 72 hours elapse.
All right. Yeah. So after 72 hours, then
after 72
not
hours,
even Jesus can save you. Okay. No. So I feel like you almost forgot about this other one and you made feature up. This is a female condom. As you can, curiosity got the best of me. So
most people don't know this.
I know. The first time I saw this, I think I was in high school, and like they scared me because I was like, where do I even put this? How do I even put it? Like, it's so big. So talk to us. Can you talk to us about this female condom?
Oh, so the female condom. It's almost the same. It works same as the male condom. They all prevent sperms from entering into the uterus. For this case, the female condom, it's quite big.
I feel like I'm embarrassed for us. Like,
I know. They're not fair to us.
I know. I feel like, look at men's. Like, you guys look at men's and then look at ours. It's like a whole handbag.
So for this case, while taking it out, take it out carefully. So for this case, we have two sides. We have this at the end of it, and we have this other side. So while putting it, kindly hold this the end. This the end of it. So kindly using your thumb, you can have it not this straight, a bit twisted. So using your thumb, you can put it, insert it this way into the vagina. So you can push it. It should not go in completely, the whole of it. So at least this part should remain outside. So and during intercourse, be careful so that it doesn't spill over. Or there are incidences where the penis can get in via side. So pushing it aside, so ensure it goes in.
All right. So like you have to really like be careful in the next part using this one. So I also feel like this should be like the last option. Always go for this one. If they're up for using
this is easier.
For the male one, always go for this one. It's a bit like easy, but this one it's a lot of work. But
because you have to be careful with this.
But I feel like as a lady, you need to have like one or three of this in the house, and maybe you can have 10 of this. So
And after the intercourse, don't forget to remove it. Don't forget to take it out.
Okay. All right. Thank you so much for that. Here is you'll be doing a lot of wiping today.
No problem.
I can't believe I said I don't want my mother to watch this episode, so I'm not even going to share it with my auntie.
I'll ensure she gets the link.
No. She's like, that is not my daughter. But But you see, that is what I don't get. I don't get why. Let me just put this on the dustbin over here. I don't get why African moms don't want to talk about contraceptives or sex. Do you know how many people would be like saved ama live up to their potential if like we were talked about like, you know, these things? Yeah? But our moms don't want to talk about that. Anyway, that is a topic for another day. Let's talk about the rest. Yeah, now let's get into the rest of contraceptives.
So, in addition to the barrier ones, apart from the female and the male condom, this one we call the diaphragm. I'm sorry, I don't have here.
Yeah.
So that one we also insert. It's inserted into the vagina.
Okay.
The same time. So it also prevents sperms from entering. So to do it all the barriers, they prevent sperms from entering.
Oh, okay. So like that is their main purpose.
Yeah, that's the main purpose.
So
one remaining, we have the spermicides.
Okay.
We have the spermicides. So for this case, these they may be in it's a gel like.
Okay.
They may be a gel like. So this it's also inserted into the vagina. So this they kill the sperm membrane. Yeah.
Like pesticide.
Yeah. Immediately the sperms get in, they are killed.
Okay.
Yeah, so they're like gel. So for this case, there are those that are the endosols.
Yeah.
This is like it works immediate.
Right.
Yeah, but for there are these suppositories. This you have to put it, then wait for 10 minutes before intercourse. So if it's an emergency, I can't advise you to use it.
So you have to like keep your whatever for 10 minutes, and then after that you can go ahead and do it.
Yeah.
So like I felt you talking about, you know, these barriers for ladies and whatever. Are there like any barrier contraceptives for men?
For men, barrier contraceptives.
It's only
this.
CD.
It's only one, the CD.
And Simba complains about me talking about feminism, surely. Anyways, so after barrier, let's talk about this other one.
So this have the hormonal contraceptives with me.
Yeah.
So there are so many. The hormonal ones have so many too. So let me begin with this. This is a Jadel, levonorgestrel. So you can see there are 2 rods in it. I have 2 rods in it. These rods, they contain a hormone. That's why we say they are hormonal contraceptives. They have a hormone. So for this case, they have the hormone progestin. So these 2 rods are inserted in the upper arm, like subdermally. Like you won't experience that pain. They are only done by like health practitioners, a qualified one. This doctor will administer for you the like anesthesia, so you won't hear because he's going to open a small part and insert so these 2 rods.
Surgical.
Yeah. It's a form of, let's say, a minor surgery. It's a minor surgery.
Okay.
So the 2 will be inserted intradermally here. So for this case, they are going to release the hormone slowly by slowly. Like it won't be once, like kidogo.
Okay.
Yeah, for this case, this one, this will last for a period of 5 years.
Right.
So for 5 years. And there's another one which can take you to a period of 3 years. So we have the 3-year and the 5-year.
Okay.
Yeah.
So I have trust, like you said, like I can see these are the ones that are going to like, you know, get inserted.
Yeah.
So does it mean by the end of 5 years katakuwa kameisha, or like is it going to melt ama?
No. The hormone in it is what will be released, but you remain with your rod. These rods will remain. So after the 5 years, you'll go back to the hospital for removal.
And then they remove. Yeah. And then tuneka kwa hii mkono ingine.
No. So while inserting it, we prefer using the hand. If you are a right-handed, we'll put it in the left-handed. Ata kama ni the 5th, you are coming for it for the 5th time.
Okay.
Yeah.
So it's like the same hand.
Yeah, the same hand.
All right. Yeah. Okay. Thank you.
So
so much
the
for
other
that,
one,
yeah?
the other one is also the same.
Okay.
It contains the rods. Yeah.
And like, is it going to be painful over time, Mama? You won't even remember it's there.
And you'll only experience like side effects, like you'll feel like this heaviness of the hand.
Oh, okay.
Like for a while, it may be one day only.
Okay.
Yeah. Thereafter, there's no problem with it.
All right. So I feel like talking about side effects, but I want us to come back after we've covered all this.
Okay, no problem.
Yeah. So this one you said it's a hormonal.
Yeah.
It releases hormones. 5 years, 3 years.
Yeah.
So it depends with when I want to have kids, right?
Yeah.
Okay. So another question before we even put it down. What if like make I have 5 years and then after 2 years I want to have kids? I can just go and get it removed.
So, yeah, that's the advantage part of it.
Okay.
Yeah, it's reversible.
Okay.
So you can go back to the hospital. Even if you want to get it removed after even 2 months, you can still go.
Oh, all right.
Because if you experience, you said we'll talk of side effects later.
Yeah.
Yeah. If you experience side effects, like severe ones, you can still go back to the hospital. It gets removed and you can choose another method.
All right.
Yeah.
Okay, so going on.
So there's this other one.
Yeah.
It appears big, don't get shocked.
I'm like, where does that go? That is what I'm asking. Where does that go?
So this too is a hormonal one. It's a intrauterine contraceptive device, the commonly known as the IUD. So this, for this case, there's the one which is copper T, and the other one is hormonal. So it may have the copper T. Okay. So for this case, I think hoping you can see. So this color of copper up here.
Yeah. I wanted to ask, is that like a wire?
It's a copper metal. It's a metal. Okay. It's a copper metal. So for these intrauterine devices, they're inserted through the vagina. So for this case, you have to be very, very cautious. So you won't just go there to the hospital and they get inserted. The doctor will have to check if you have a risk of infection. If you have like pelvic, like this condition, pelvic inflammatory disease, if you have like cervical cancer, so for this case, this won't be suitable for you. For that case, so I think the doctor will have to do like a pap smear to determine that pap smear, like to check if you have any cancers, the STD test. So to be sure that you are safe for this. So this copper T will take you for a period of 10 to 12 years. So it's a long-term contraceptive, very effective for those who want a very large spacing of kids. Or if you don't want kids, you can try use it. If you have achieved you're almost like you're remaining with 10 years to menopause, you can go for this. It's very effective, but with the precautions that I've said, you should not be at risk of infection, and you should not have the pelvic inflammatory disease. To do with cancer, you should be also cancer-free. Okay. Yeah. So for this, you want me to explain on how it's inserted?
No, it's just inserted. I feel like you guys, if you need this, you have to go to the hospital and get it inserted. But it's inserted.
Yeah,
right?
It's inserted.
It's inserted. I think,
so this, it's pushed until to the uterus. Okay. So for this case, because it has the copper ions, so it will be releasing the copper ions slowly by slowly. Okay. So these copper ions will be very unfavorable for the sperms. Okay. They are toxic to the sperms. So at any point sperms get into the uterus, they'll be destroyed.
All right.
Yeah.
Okay. So maybe my question would be like, can they like detach themselves? Like you've said they go for like 12 years. So is there like is there anything maybe I can do without knowing or make them like detach themselves?
So for this case, while using any IUD, whether it's this copper, this copper T, or the progestin only, you should be very, very careful. For this case, if you choose this method, ensure you stick to one partner. Okay. Yeah, you stick to one partner.
I want to ask why.
I was coming to that. The more you have different partners, the more you interfere with this. Oh. So for this case, and this will expose you to a risk of infection at the same time. You having two different partners or more than two, and this is a metal in you, so it's going to get infected. This will cause you an infection.
Okay.
Yeah.
Oh, I get you now. So, like, having multiple partners can introduce infection to this.
Yeah.
And then it stops working, and then, well, twins.
Not really, like, it won't stop working, but it will cause you, like, more side effects. Like, you'll experience severe side effects.
Okay. Well,
And at some point, it may... it may change the position, the right position that it should be.
Okay.
Yeah. And to do this, you must go for frequent checkups.
Oh.
Like, have a checkup, like, with your doctor. Even you can go even after 3 months. But for the first time of insertion, after 1 month, you have to go for checkup. Then thereafter, you can go for checkups for 3 months. Yeah.
Okay, I know we said, like, this one I can be able to remove at any point I want.
Yeah.
What about this one? Can I also be able to remove it?
Yeah, this one is also reversible.
Okay.
Yeah, you can remove at any point you want it. Yeah.
Well, you know, when you said partners and it's inserted, my mind went absolutely different direction, but I'm so glad for that clarification.
Yeah.
And you guys don't judge. We are all thinking about it.
We're all here to learn.
Yeah, we're all here to learn. My
Yeah.
mind took a different direction.
Yeah.
All right, thank you for that one. So this one?
Yeah. So this family plan, most people know this.
I feel like I knew about this, like, when I was 10, but I used to think, like, ni painkillers.
Yeah, hata kwa
Like,
chemist inakuwaga on display.
Yeah, I used to think ni Piriton.
Yeah.
Yeah.
So for this case, let me show you.
Yeah.
It looks like this. We have the white one, like,
Yeah,
and
maroon.
the maroon. You can say they're brown.
Yeah, brown. Okay. Alright.
So for this case, these are oral.
Okay.
They're oral. So for this case, we're saying oral. These are combined orals. When I say combined, I mean they have 2 hormones. So these ones contain the progestin and the estrogen. So for this case, if you choose on these combined oral contraceptives, you have to take them daily. You have to take them daily, each and every day, without skipping. So for this case, on the other side, they are indicated, in fact, clearly. So you've been showed where to start.
Okay.
Yeah, if you buy this, you'll see to start. The start day 1 from day 1 to the last day. And while starting, you have to ensure you are not pregnant.
Okay.
For this case, you can begin them from day 1. You start your menses. It's very safe because you are sure you are not pregnant.
Yeah.
If you begin maybe from day 5 after the beginning of your menses, this means maybe you started your menses on 1st.
Yeah.
On 1st of May. So today is on 6th of May or 7th of May. So for this case, you have to be sure you're not pregnant, and for them to be effective, you have to take them for 7 days.
I have a question.
Yeah.
So let's say I start taking them today, right? And you've said, like, there's an indicator, like, you have to take them every day. So how soon can I have sex and be protected from them? Like, is it like the first day I take the first pill, or do I have to, like, maybe take them for 7 days and then maybe I can have sex?
So for this case, this is what I'm saying. After the 6th day of your menses, so you should take them for 7 days.
Oh, all right. Okay.
That's when you can be sure you're protected from pregnancy.
Not day 1.
Not day 1. But
Okay.
if you take them from the first day of your menses, you are protected.
All right.
Yeah.
So I have to take them. Okay. What about time? Like, do I have?
So timing, you can choose on your time, the best time for you. You can choose either to take them in the morning or at night. So
And does it have to be like the same time? Because I saw that, like, a lot of ladies ask you. So if I decide I'll be taking them at maybe 4, do I have to, like, take them 4 every other day?
Yes, to make them effective, especially I will prefer someone to choose them, to take them at night. Because in the morning, kuna ile siku utaamka na haraka, then you'll forget to take. But when you decide to take at night, maybe you can decide to be setting an alarm. I'll be taking these pills even at 9 p.m. So at 9, ensure you take the pills.
All right.
Yeah.
Okay.
If you can be very accurate, even you can decide to take at the exact time. There's no problem. The more effective it will be.
What happens if I skip?
If you skip, you start the dose.
Again?
Yeah.
So, like,
if you skip, if you are this, maybe day 11, you'll begin. you'll have to begin.
Okay.
Yeah.
And then like wait for another 7 days, and then before 6 days before like you
Yeah.
can, like now I can be sure like I'm protected.
Yeah.
Wow, that seems like a lot of work.
Hey,
Yeah.
and these, they're in 2 colors.
Yeah.
So the white ones are the ones which are combined with the progestin and the estrogen.
Yeah.
So we have the brown ones. These brown ones contains iron.
Okay.
So see, during the period you experience menses,
Yeah.
you lose blood. So for this case, this is to supply you with enough iron.
Okay.
Yeah.
For the blood.
Yeah, for the blood.
Nishakuwa Dr. Nancy. Anyway, you guys, but this seems like a lot of work, and yeah. Anyway, thank you for that. So let's talk about that one.
This is another one I have. This one, it's a progestin only.
Okay.
I talked of that as a combined.
Yeah.
This is a progestin only.
Okay.
You take them the same time, like the same way you take these ones.
Oh, okay. So
Yeah.
like they are sisters.
Yeah, they're sisters. Yeah, they are pills. They're still pills. They're sisters. So
Okay.
only that these are combined. These are progestin only. Yeah,
Now, are they
one
effective?
hormone.
They're
Yeah.
also effective,
They're
right?
so effective. So
Okay.
for this case, I think this we prefer for women who are breastfeeding, especially a woman who has delivered, so has come after 6 weeks
Yeah.
for the postnatal clinic. Yeah, to bring the baby. I will also advise on family planning. If she's not for the other methods, if she chooses the oral ones, we're going to give her this one.
Oh, okay.
This one will be more effective for her. This one will be less effective because it contains 2 hormones. The estrogen in it is going to suppress the milk. So the baby is going to lack
Milk.
the milk. Yeah, that's why we prefer the one with the progestin only.
Okay. Oh, I'm learning a lot. I feel like even when like I'm pregnant, when I go to the hospital, I'll know what to ask for. I'll be like, yo, doctor, I'll be one of those patients. Like, everything. The doctor is like, just shut up. Yeah, and listen. Yeah, this one's very small.
This one is an injectable.
Yeah.
It's an injectable. It's also a hormonal one. This one, it's known out like most of us, we call it Depo-Provera.
Okay.
Yeah, it's Depo-Provera. This one will only give you a protection of a period of 2 to 3 months.
Okay.
Yeah, Depo-Provera will give you for 3 months.
All right.
So after 3 months, you'll have to go back to the hospital. You receive another injection for Depo-Provera, and it is injected here on your upper arm. Yeah.
All right. So for 3 months.
Yeah, for 3 months.
So I have to go in for 3 months.
So the disadvantage part of it, these other ones, we say they're reversible.
Yeah.
If you want to get them out, you can go.
Yeah.
But this, if
not.
you experience anything, so you'll have to wait for the 3 months to be over. So if you experience, even if it's severe bleeding, at your 2nd month, you'll have to wait. So because you can't remove, it's injected.
Oh, so it's like in the blood.
Yeah,
and all
it's in the
that.
blood already.
Okay. Well, not scary at all. I feel like so far you ladies can decide on, what you want, like what you want, which one you prefer. You, of course, whether you are trying or not, how long you don't want to have babies. And I feel like, thank you so much for that. Yeah. So let's now get into some other questions. How soon do I start, maybe, how do I say this? How soon can I get pregnant after being off like these contraceptives?
So after taking contraceptives, in fact, you can be fertile again for even for after 1 month, 1 to 3 months. So depending on the type of contraceptive you are using.
Okay.
And depending on your body, there are some which will cause hormonal imbalances. So for this case, you'll have a delayed fertility.
Okay.
Yeah.
So like you have to wait, like maybe if you get off them, maybe give it a month, and then you can start maybe creating that baby. So do they cause infertility? Because I feel like a lot of people are like, especially when you do like this one that goes for 12 years, many women are like, you cannot be able to have kids after that.
No, you can. It's possible. You can get kids. So only I can say like it does not cause fertility, but it causes not a permanent fertility, but a temporary fertility.
Oh, okay. So like for a few months, like you said, or weeks, you may not be able to conceive, but after that you can definitely conceive.
It may cause a delay, not a permanent infertility.
Yeah. Now let's talk about side effects. how are you even able to tell that like this is a side effect from a contraceptive, ama you are sick, and what are some of the like common side effects of contraceptives?
So for this case, most common side effects of these contraceptives, you may experience nausea, vomiting, their dizziness, especially to do with implants. Nausea and vomiting happens for the orals. You may experience headache. To some extent, it may progress to migraine. You may experience, I think those are the most common. So the others, maybe they are complicated cases, but most common cases, you experience nausea, vomiting, headache. But these are manageable. Because our main aim is to prevent pregnancy, for that reason, it overweighs the side effects. So we can't fail to go for contraceptives because of such.
Kunywa mara moja. Anyway, so what are some of the factors I should consider before like going on these contraceptives?
So for this case, while going for contraceptives, you'll have to. You can't choose it by yourself, especially most of the times.
Because I'm like, well, let's do this.
Because you might choose the wrong one for yourself. So you'll have to visit the health facility. Here, counseling is done first. You won't just go there and say, I want an implant. They'll have to counsel you. They'll have to show you the types they have. They'll counsel you. They repeat the same thing. They tell you the side effects. They'll have to ensure your vitals are okay. They'll check for your BP, whatever, pulse. They'll ensure everything is all right. So from that point, this will determine the type of contraceptive you use. So for this case, as an individual, you may go there also. All may be even very, very fine for you, but you'll have a decision now to choose. You'll tell the doctor, yes, I want this, I want the injectable ones. Maybe due to your social life, maybe you want to space your kids with 5 years or 2 years. So for this case, if you want to choose, if you want to space your children for 5 years, obviously you'll go for this. You'll go for this, the Jadel, for 5 years, to space kids for 5 years. If you only want a short period, maybe you stay alone, the spouse is away. So this spouse is coming even for a 2-month leave. So for this case, you'll go for depot.
I'm getting good at this.
You'll go for depot. Because there's no need for like introducing more hormones into your body for a short period. Then he's only there for 2 months. For that case, you'll go for the shorter, or you can even decide to use the condom for that period of time.
All right. Well, us with condoms. I don't know. Anyway, okay. These things I've heard about people saying, contraceptives, like you said, they don't cause infertility. Now, others say like they cause cancer because of the hormones. When you don't understand something, it's very easy to assume something. Is there any risk of you getting cancer because you are on contraceptives?
Yeah, there's a risk.
Oh, okay.
There is.
I wanted you to be like, no.
I can say there's a risk. At the same time, I think I should say no risk.
No risk. Okay, explain.
So for this case, I talked of the intrauterine devices. For this case, I say that for this you have to be strict like to one partner to avoid such cases. For this case, with many partners, you're going to get an infection. This may complicate at some point. You may get the cervical cancer or the reproductive tract cancers. On the female side. So this is the reason I can say they cause some cancers at some point. So you have to be careful.
So and when you say careful, like stick to one partner, go for regular, checkups. So you don't just put there and you're like, well, see you doctor in 12 years. See you in 12 years. No, don't do that, right? That is for your own good. Okay, there are people who will be like, especially men, I've had this with men, who like think contraceptives can make their women, or reduce the sex drive. So they decide to go for like the pull-out method. So my first question would be like, do contraceptives reduce the sex drive, and how effective is the pull-out method?
So for this case, contraceptives, they may reduce the sexual desire.
Yeah.
Can say that by reducing the libido. So for this case, we can say like the progestin only. For this case, there's a point at which the estrogen levels may be low. So for this case, one may experience a reduction in libido. So you get it. So there's a decrease in sexual desire.
Alright.
So that's a fact. But at some point, I think it happens as an imagination. At some point, we put claims on contraceptives.
Yeah.
As for a person, like we can say sexual desire is controlled by the brain. So for a person who is stressed, who experience who has many issues to do with stress, so for that case, this person won't be interested in sex.
Yeah. So it's not about contraceptives.
Yeah.
Stop blaming the contraceptives. right.
Yeah.
So
we can say both. There's a point where contraceptives play a role. Yeah.
And sometimes it's just us being in our head. So pull-out method. How effective is that?
Pull-out method, I can say it's not, at some point it's not really effective. Yeah, because pull-out method for this case, there are some men who experience premature ejaculation.
Okay.
So for this case, after before he realizes he's yet to do it, Asha ejaculate. So for this case, it won't be effective.
Right.
And those who won't be for it.
Okay. Yeah. The one who are like, I'm an expert, I've been doing this. No. Let's not risk it.
Yeah.
So this other
But
one,
if you can, I think I can say it's
remember you're a doctor, so don't give them ideas. Yeah. But honestly, what do you think? Yeah.
But the good thing with it is that there's no point where you'll experience any side effects.
Okay. Yeah.
There's no hormones involved there, so it will be fine if the guy understands and is able to do that.
Okay. So which makes me think as a doctor, who do you think should make the choice of getting contraceptives? Is it the man or the woman?
These things should be discussed between the two.
Okay.
Yeah. You have to make an agreement. You have to talk, decide. Maybe if it's for the sake of children, maybe you want to space, you have a young kid, you agree on what method to use. And it's even more better when going for contraceptives, the two partners go there.
Okay.
Yeah, I think nowadays we encourage male involvement in family planning, contraceptives. So for that case, the two have to decide. If it's the woman alone to go for the contraceptive in the healthcare, she must go there knowing what to go and ask for. Yeah.
All right.
Yeah. In case of any changes, he should inform the partner.
Okay.
Because these things sometimes they cause issues in families.
Exactly.
Yeah.
Exactly.
And for this case. I'm sorry to say this, because most people come, especially those women who come their partners don't know, they come demanding for the injectable ones. There's no evidence.
Oh, okay.
You won't know,
so the man doesn't know whether she's on contraceptives or not.
Yeah.
Okay, I do see your point. So you have to if you're in a relationship,
because for the case of the implants, there are some men who know. He'll touch here. Tashika and ataskia he's a rod.
Oh my god. So to avoid all this, just talk to your man. Talk to your man and decide on what you want. So vasectomy. Yeah, many men don't want to be I feel like they don't have, apart from condom, and I think there's something about meal whatever.
So that's what I talked about, the permanent contraceptives.
Can you reverse vasectomy? Once it's done?
No. That's why it's a permanent method of contraception.
So
because for this case, they completely block the duct. In fact, it's cut.
Oh.
So for this case, there's no passage of sperms. Oh. So at any ejaculation, there are no sperms passed.
Yeah.
So for this case, it's a permanent. Once you decide on that, it's a permanent. No reversal.
There's no reversing that. Just reminded me Simba asking where do they go. After you cut, where do they go? Where do they go? anyway, I hope you guys have been able to ask every question
Yeah,
you
on the-
ladies have. Yeah, maybe you can add something. Maybe I've
So
forgotten something.
on the permanent one, well, we have the vasectomy as the male permanent.
Yeah.
For the female, we have we call it the tubal ligation. So for this case, it's a permanent for females. Here we can't. The fallopian tube is cut or it's tied.
Okay.
With clips. So for this case, the ovary won't be able to travel. So there's no fertilization at all.
Okay.
So it's also a permanent method for the females.
Now it's surgical, like
Yeah,
the way
it's
you said
surgical.
you-
It's surgical.
Okay.
Yeah.
So you guys, I hope now you have like enough information to decide on what contraceptive you want to be on, rather than risking it, especially with P2s. And nowadays there are like a lot of P2s in chemists. Like there's a lot. There was this episode I was seeing ladies talking about P2 babies. Like, you know, you take P2 and then you still get pregnant because they are like all fake, and it's, if you're not a doctor, you're not going to know which is real and which is not. And I feel like to avoid all that, you guys make sure that you decide on what contraceptive you want to be on, right?
Yeah.
Yeah.
And for this case, to do P2s,
Yeah.
they are most commonly misused.
Yeah.
Because one may decide even to take P2s even 3 hours per month.
Yeah.
But like medically, P2 should only be taken, I think, if at most 2 times a year.
2 times a year.
Yeah. The more you take P2, the more you make them less effective to you.
Oh.
So if you're used to taking P2s, like you've been taking for the last 2 months, like
Yeah.
every week you're on P2s. So that's where you experience unwanted pregnancy. You took P2, yes,
yeah.
but you're going to get pregnant.
And thank you for that for that clarification. But because I feel like in university, the reason why ladies were not taking P2 now and then is because they thought they were going to be, you know, it's going to cause infertility. But now you're saying it's because it's going to be like, you know, less effective. That makes a lot of sense.
Yeah.
So you're not safe using P2, guys. Not all, at least not always. Yeah.
Yeah, P2 should be an emergency.
Okay.
Used for emergency purposes.
Only. So thank you guys so much for watching. Frida, I'm so grateful. Thank you so much for saying it as it is.
Yeah.
And of course, we are going to be having you as well. Like, this is just the first visit of many visits.
Thank you so
excited
much
for being here. So yeah. Anyway, so we are like closing up. Maybe you can tell our ladies, even men who are watching, something.
I can tell. I think so far. I think you are able to learn. You've learned something concerning the contraceptives, and contraceptives are not limited to most, like, there's no way you'll go in hospital and be denied contraceptives for this case. And contraceptives are effective only if you consult the doctor and the doctor helps you choose the right one for you, which is best for you. And for this case, I can say contraceptives, I don't advise so much for those who are teenagers. Try abstain.
Abstain.
It's the best method.
It's the best contraceptive.
It's the best contraceptive with no side effects. So,
Yeah.
yeah.
Okay.
Thank you.
I feel like when you say abstain, I'm like, yeah, I'm with you. If only they abstained because, well, you know, that's anyway. Anyway, guys, I'm so excited for having this conversation. Like I said, I hope you guys have learned something. If you have enjoyed this content, make sure you subscribe and comment, and maybe even share your experiences on the comment section. You never know who is watching or who's going to be reading your comment. I've been Nancy Korea, and thank you so much for watching this. See you in the next video, and maybe I'll bring Simba back. Anyway, I'm not sure. I'll still decide on that. See you guys next time. Love you. God bless. Stay safe.
Okay. Thank you. Bye.